Hello, and welcome to Personalized and Compounded Nutrients podcast. Today, I am in Sarasota, Florida, and we are located at Precision Health and Aesthetics with Dr. Ossie and Dr. Mullen. Did I get it right? Okay. Yeah, they're joining us here today, and we're going to have a little discussion about specifically how evidence-based supplementation fits into a longevity medical model, how biomarkers, genetics and wearables guide individualized nutrient plans that they are developing here for their patients that cut through the noise of over-the-counter supplementation, and also how personalized nutrients has helped them build those plans out for personalized supplementation. So maybe you guys can share a little bit about yourself, and then maybe we can dive into some of this information. Would you like to go first? Dr. Mullen?
So I'm Patrick Mullen. I went to school at UC South Florida, just up the road here in Tampa. I went on to do some more training at UNC in Chapel Hill. And then Dr. Ossie and I have been friends since medical school, and he coerced me to move down with my wife to help revamp the practice and kind of change a lot of initiatives here.
As he said, also went to University of South Florida. We were in the same class. Both of us in med school realized we were very interested in nutrition as a whole, specifically sports nutrition. And during medical school, a lot of stuff that we learned was contrary to what we knew, which was, kind of bro science. But it's kind of funny because since we've graduated, a lot of the stuff that we were saying back then has turned out to be true. So we learned it, and then I learned it in med school, and then we relearned it again. And now we can confidently, tell our patients that we do know what we're talking about with nutrition. The science backs it up, as well as a lot of the supplementation. Obviously, there's a lot of hocus pocus and snake oil in the supplement industry, but as physicians, that's really our job to find what's real and beneficial for the patients. And so that's really what we do.
Thank you. So how would you explain how evidence-based supplementation fits into a longevity model?
So we do have evidence of certain supplements, specifically NAD precursors and different mechanisms for different supplements, such as berberine, bergamot, things like that are coming out that are really showing the power of antioxidants and regulating inflammation in the body, regulating blood sugar, mainly for berberine. Some unknown mechanisms that we haven't really figured out yet, where we're finding increases in GFR and decreased inflammatory markers, and some showing actually better cardiac benefits, as well as some renal benefits. And so there's a lot of stuff out there that we know, and a lot of stuff that we don't know. And as the science kind of gains traction and we have more studies, then we can say, okay, we have X number of people, usually in the thousands. We don't want to go on like a one-off. For example, I've treated several patients with bergamot, berberine, and watched their lipids improve, and they have a high risk of cardiovascular issues due to their family history in their labs. And so I can't say, oh, I did that with 3 people. It's like, well, when we have the evidence from scientific research with thousands of patients, then we can say, okay, we have a hunch, and then we can start trying it. And then where freedom to formulate comes in is that we have the purity, which is a huge issue in the supplement industry. So you don't know what you're getting when you're buying from some random supplement company on Amazon, whether you're actually getting the supplement, if it's a counterfeit. And then also, on the other hand, even if it is the right brand, is that brand actually putting into it what they say? So with Freedom to Formulate, we have testing of the ingredients before they go to the factory, so before they get into the factory, and then post-testing to make sure that's what is in your supplement is actually in your supplement. Those are all from third-party labs. And so we're seeing the results on our patients' labs, which is like the most exciting part.
Excellent. Would you like to share anything regarding that?
Yeah, I think it's really helpful in order to kind of put where supplements fit into a medical plan or a medical model. It's not in replace of any lifestyle factors. It's not in replace of medicine. It's in augmentation and probably in between lifestyle and medical management. So it's used as a combination therapy. I feel like a lot of medical models just skip that overall. And it's an important piece that you can use in addition to somebody's whole medical plan, especially when we're thinking about the long term of a patient's health. I think that is really valuable. And then, especially because medicine has been, I guess exiled or, self-exiled from supplementation. And a lot of times it leads other industries in there to sometimes co-opt the space and, create a lot of noise and confusion. Having the medical provider have control over things, right? So the actual name, freedom to formulate, I can pick and choose the amounts of things that I want to go in there instead of relying on an off-the-shelf formulation to say, oh, well, you need to take 3 of these to get the amount that you need of one, and then you
Right.
get 3 times the amount of the other ones that you
Mhm.
so you have the control, and then if it's used in combination with all the other factors that we have at our disposal, you can get really great outcomes for a patient. You never have to use a sledgehammer to use a finished nail. And then similarly, you're never stuck there with, a tiny little, pickaxe when you need to dig out a giant tunnel to sweeten.
Gotcha. Beautiful. And then how with the something you had mentioned that you want to discuss was how biomarkers, and genetics and wearable guides, individualized nutrient plans. How would you explain this? And how does personalized nutrients come into play with that?
Yeah, not everybody was printed on the same machine with the same exact instruction manuals. And we all come with our own genetic codes. We've all got our own, predilections and predispositions from a lifestyle and genetic potential. You need to have a plan in place for these things. So you need to do actual testing to know what are your deficiencies, what are you starting at, what are your goals, and then are we replacing something that was deficient? Are we super saturating something to get a benefit or an outcome that we're looking for after? And then we can monitor some of these things with wearable data and lab data to get feedback and make sure that we've improved. So we do baseline testing for all of our patients. And we're looking at micronutrient deficiencies, mitochondrial function, toxic exposure, oxidative stress. We use that to set the baseline or kind of the bare minimum of supplementation. Then we go through any, symptomatic problems, any other long-term health goals from cardio, metabolic risk factors, bone and joint disease, eye disease, memory loss or cognition support. And we're kind of adding or super supplementing with certain things related to that. And then we can track those lifestyle factors and feedback through lab markers and wearable data. If somebody's coming in for sleep disturbances and we go through their sleep hygiene and we try to optimize this, we test and figure out that perhaps they're low in a couple different neurotransmitters, and we give them a blended support to help with a symptom of sleep. And then we track the wearable data to say, oh, you had 5% deep sleep and an overall, sleep latency of, 35 minutes. And now we've gotten it down to a sleep latency of 8 minutes and a deep sleep of, an hour. We know we've made some improvements and we can monitor and make sure that efficacy stays high.
Right. So you're really seeing personalized nutrients as a tool that can be measured,
Yep.
right? Did you have anything you'd like to add?
In addition to that, we get to do what we think is right. So, for example, you go to CVS and you might get something for sleep. You can get 10 milligrams of melatonin. And I have patients that told me, oh, I'm taking 5 of them, like taking 50 milligrams of melatonin. And, we do have research showing excess use of melatonin has higher cardiac risk, risks of dementia, and, on and on. And the research is still, compiling because it's only been, 10, 15 years maybe that the America as a whole has like hopped on the melatonin train. Because everybody, I think the biggest complaint that we get from older people is not enough energy, can't sleep, and apathy. And what we did was we created our own sleep blend that hit 4 different mechanisms. So melatonin being one of them. However, we didn't want to do a lot of melatonin. So per serving is 1 milligram of melatonin, which is much less than anything else. It has its place, but you don't want to overdo it. And so we did valerian root, we did tryptophan, we did 5-HTP, we did poppy seed, we did magnolia bark, and a thing that slips my mind, but basically we hit the different receptors for sleep. So basically helping people to fall asleep, stay asleep. And I have some older people who said literally it's the only thing that's worked for them. It doesn't work for everybody. Obviously, sometimes we need to go to pharmaceuticals, but that's like a really big tool that we can use for our older population, which here in Sarasota, we have a very high percentage of older patients. But there's just one more thing that we can use that we know the benefits and we know what we put in it. So I can 100% tell my patient, this is what it is. And, let's try it out. I can have full faith that I'm not harming my patients. That's the most important part.
Yes, that is very important. What else could you share with the public about utilizing personalized nutrients that you like the most?
I'll say, as a concierge model, patients pay for our time and value. Selling a bunch of supplements in addition or trying to make money off of something has a conflict of interest there. Patients have already paid for our time, our energy, our value. And what we like is being able to extend some of that value to them. So we can take a lot of their over-the-counter or off-the-shelf supplements, combine them into, one easy to use, one big beautiful pill. And then they only have to take, about 20% less number of pills total during the day. And then we typically can save them anywhere from 20 to 30% of what they were spending. So high quality medical supplements cost a lot of money. We have a lot of patients that spend a lot of money on these things, and we can probably save them by cutting out some of the, fillers or,
Right.
extraneous things that may not be as much benefit to them, and giving them just what they need instead of too much of one thing to get enough of another.
And getting rid of that ingredient overlap that could sometimes be dangerous, right?
Yeah.
That's
Like-
that's the biggest thing is the ingredient overlap. So I don't have to prescribe or, recommend 5 different things. And also, like he said, I'm not in the supplement sales business. We don't push supplements on anybody. Any of the patients who are interested or who already take supplements, 100%, I get it on a personalized supplement because I can put exactly what I think needs to be in there, validate through testing. And we do have patients who come in on 20, 30 pills, they go fill out some survey online that doesn't even have any blood work, or if it does have blood work, it doesn't actually test for what the supplements are treating. And then they get, their stack and it's 7 different bottles. And we've had people coming in literally taking 20 pills. And then we do the personalized supplement. We cut out a bunch of overlap because those companies are still sending you overlapping supplements, which is absolutely nuts to me that people are paying for this. And they're paying a lot of money too. They're not cheap. And then, we had one guy taking 20 pills and we got him down to, I think, 11 and plus a better formulation. And then the crazy part is when you do their labs and you see improvements based on that, it's like, well, if the stuff you're already taking was such high quality, then what's the problem? Is it the quality? Are they lying about the amount of nutrients? Is it old? Has it been sitting on a shelf for 5 months? Like, where is the disconnect? We don't know. What we do know is what we're getting from Freedom to Formulate has actually on the lab shown to be better. And so like for myself, I did testing and I've been on it for 3 months. One of the things for Freedom to Formulate, I haven't found anybody that has the S-acetylglutathione. You guys are the only ones that have it. So I put that into my personal blend, and then I'm going to retest next week and see what my results come back as.
Oh, we look forward to hearing about that.
Yeah. So,
yeah, for sure.
And it is super cool. Like, I have patients who are borderline diabetic, right? Their A1C 5.9, and I put berberine in their personal supplement so that they don't have to take anything extra. It's already in there, and their A1C is now within normal range. And so like, you can't do that with anything else.
Right.
Here's another bottle. Here's another bottle. So it's not only that we're cutting down on the amount, we're increasing their
likelihood to take it, their compliance.
Their compliance. We're increasing their compliance.
We definitely see better patient compliance.
Me, myself, sometimes I would forget to take 1 or 2 supplements, and now I don't do that anymore because I literally just put it on my shelf where I put my belt. So every day before I go put on my belt, I take my supplements.
Have your little protocol there so you don't forget. Yes. And yeah, to be able to simplify it, especially for our seniors, like in Florida, in this area, we have a lot of seniors, a lot of snowbirds, and to be able to make a regimen easier and more simple for them to take, they're going to see those patient outcomes. And like you mentioned, when it's Concierge, people spend really good money, and they want to see those results. And this is a great tool to accomplish that for the patient. And then also for you guys, what you're doing is doing right by the patient. Well, thank you so much for joining me today on the podcast. Thank you guys. And the audience there will stay tuned for some more podcasts coming soon. Thank you. And we'll talk to you later. Bye.